kayo, ako, do not panic. The crisis is very, very clear. COVID-19 is spreading all throughout the country, including the Philippines. Ang ano natin dito is there is no cure.
Do not touch your face like this.
Medical advisories from the World Health Organization has reminded us time and again not to touch our face, nose, and mouth so often. This helps reduce the chances of catching the virus, as infections from your hands do not reach the nose or mouth, from where it can infect the body. Keeping your hands clean will also help reduce the chances of the infection spreading any further. Do not travel unless necessary. The Centers for Disease Control and Prevention in the United States advises against overseas travel unless it is absolutely required. If you do decide to travel, make sure you adhere to all safety regulations in your location. It is also a good idea, though not required, to get tested for COVID-19 before you leave, to avoid becoming unwell while on vacation or transmitting the virus to others. Also, follow the WHO's recommendations for wearing face masks, and keep in mind that masks work best when used in conjunction with frequent hand washing. Wearing two masks, a surgical mask topped with a cotton mask, is a sensible precaution with new more contagious strains of the virus being detected in regions all over the world.
To prevent spreading of COVID-19 virus, we should keep a good hygiene. By following good respiratory hygiene, you protect the people around you from viruses that cause colds, flu, and COVID-19. To ensure good hygiene, you should regularly and thoroughly clean your hands with either an alcohol-based hand rub or soap and water. This eliminates germs that may be on your hands, including viruses. Cover your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Dispose of the used tissue immediately into a closed bin and wash your hands. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets, and phone screens. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. The most common symptoms are fever, cough, tiredness, and loss of taste or smell. The less common symptoms are sore throat, headache, aches and pains, diarrhea, a rash on skin or discoloration of fingers or toes, and red or irritated eyes. The serious symptoms are difficulty breathing or shortness of breath, loss of speech or mobility, or confusion.
To prevent spreading of COVID-19, we need to avoid gathering so that the case of COVID-19 does not rise somewhere. And we have to follow the safety protocols not for only ourselves but for everyone. If we follow the basic safety protocols, we reduce the chances of getting high cases of COVID-19.
Bringing fresh outdoor air into your home helps keep virus particles from accumulating inside. If it's safe, open your doors and windows as much as possible to let fresh air in, while it's preferable to open them all the way. Even a slightly broken window can assist. Open as many doors and windows as you can to enable more fresh air to flow inside. Use fans to circulate virus particles from your house to the outdoors. If you have a window exhaust fan, consider utilizing it. Make sure it's the window safely and securely. Another alternative is to set a fan as close to an open window or door as feasible. with the fan blowing outdoors with small children. Don't leave fans unattended.
You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs and viruses, like before, during, and after preparing food, before and after eating food, before and after caring for someone at home who is sick and has virus, before and after treating a cut or wound, after using the toilet, after blowing your nose, coughing or sneezing, and after touching the garbage.
The face mask need to be a mask attached to the head by sling to the ears or head. That is scarf or t-shirt cannot be used. Face masks help reduce the spread of COVID-19. We encourage to you wear a mask whenever you live in the house. Social distancing measures are being taken to limit when and where people come together to stop or slow spread of infectious disease.
It's important that you don't lose your COVID-19 vaccine card, which shows your personal information, the date you were vaccinated, and the type of vaccine you received. It is your best evidence to show proof of vaccination when you need it. Also, hand sanitizer may help rid your hands of germs that can cause COVID-19. There are many times you should use hand sanitizer, such as before and after touching a surface other people have touched.